Good morning, I'm Andrea Leonard, President and founder of the Cancer Exercise Training Institute. This morning I want to talk to you about cancer treatment and weight management. Having extra body fat, having a higher percentage of body fat in a cancer patient can not only lead to heart disease and diabetes, which, by the way, they are at a higher risk for, particularly following chemotherapy and radiation, but it can also lead to future cancers. So education is a big part of our job, in addition to putting together an exercise program and letting people know why it is they need to be concerned with, what it is they're eating, whether it be, the foods they eat or how much alcohol they intake, and that it's going to improve their long-term survival rates to have a healthy body composition. So I know that as part of an exercise program for the person coming out of cancer treatment or during cancer treatment is going to be cardiovascular exercise. Now, the exact quantity, the intensity, all of those things are contingent on where they are in treatment and recovery. And there's much too much to speak about in this short little video, but it's really important to educate yourself on all of the ins and outs of working with somebody with cancer. But in any case, our goal is to strengthen their heart and lungs to either maintain or improve body composition, and we can do that through cardiovascular training as well as, of course, strength training and building lean muscle mass, which will, of course, burn more calories. Plus, it will help to prevent osteoporosis, which, particularly with the hormone-related cancers, there's a much higher risk of osteoporosis, also with thyroid cancer, and then anyone who's undergone chemotherapy. So, unfortunately, the body composition can be altered by certain cancer treatments. There is a lot of muscle wasting. Many times people are not getting the nutrition that they need for various reasons. They may lose their taste, they may have changes in taste or smell, and food suddenly becomes unappealing. They are unable to absorb the nutrients in food. They are physically unable to swallow or chew. So really important to not only educate your clients on the basic principles, the food pyramid and calories burned, calories consumed, but don't try and work with somebody out of your scope of practice. This is an area that really needs to be addressed by a registered dietitian and one that specializes in working with cancer patients. If you're just a trainer, not just a trainer, but meaning it is out of scope of practice to make dietary advice, and you're getting yourself into a big legal mess potentially if you do so. So find somebody, local hospital, talk to the local doctors that you can actually refer your client to, and you're doing them the greatest service versus trying to make guesses on your own. So we can learn a lot, we can educate ourselves on proper nutrition for cancer prevention and management, but nonetheless, that doesn't give you the right, if you will, to make that, give that advice to cancer patients. Because there is an increase in body fat, there's also that natural loss of lean muscle mass, and so their basal metabolic rate is naturally going to decline. And although their weight may remain the same, they may actually gain a size or two. So, we're already dealing with somebody who's dealing with a life or death diagnosis. They may lose their hair, they may lose a breast, a prostate, a leg, what have you. And then on top of it, they're in their own mind getting fat, and their self-confidence is shattered, their self-esteem is shattered, and quite frankly, it's affecting their health now and in the future. The other part of this is that there's naturally going to be a decrease in physical activity, particularly during treatment. 76% of cancer patients are going to have extreme fatigue. So with this decrease in physical activity, they must decrease the amount of calories that are consumed. And this is just common sense, regardless of what those calories are. So increase exercise whenever possible, even if it's incrementally. So they do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. Cumulatively, we're looking at calories burned and just whatever we can get out of somebody, because they may not be able to do 20 minutes, 30 minutes, let alone an hour. So as far as some basic recommendations that you can make, of course, choose foods with a lower caloric intake. A lot of people don't even know how to read a label. So help to educate your clients and show them, what is a calorie dense, wasted calories food versus something that's high in fiber, high in nutrients, that's going to be more satiating. And so foods that are high in fiber will naturally have that effect. It'll fill somebody up, and it will also keep the bowels moving, which is so, so important for all of us. But the longer those potential carcinogens are in contact with the mucosal lining of the stomach, the more detrimental they potentially are. So we don't want to, put fuel on the fire, so to speak. And then limit foods and beverages that are high in calories and fat. Good God, just tell somebody to stop going through the drive-thru, stop drinking soda, stop eating foods that are in a wrapper, stop eating things or drinking things that have all of these ingredients that you don't even know what they are. I mean, that's just really basic, easy advice. And then drink plenty of water. It'll help rid their body of toxins, help their kidneys work properly, which can also be impaired from a number of different cancer treatments. And of course, help ultimately with weight loss and overall health. And then teach them how to balance calories consumed and calories burned. Show somebody how to calculate the amount of calories that they burn during any given exercise, and then what that equates to. Sometimes if somebody, you go to the Cheesecake Factory, let's say, and you look at the calorie list and see that a piece of cheesecake is 1,000 calories. Those of us who are trainers would go, okay, well, I'm going to need to do 2 hours of high intensity cardio to burn off that piece of cheesecake. But the average person, although they know it's not good for them, has no clue. They're like, well, it's only this big, but they don't realize how calorie dense it is. So this is a time for you to be able to educate well beyond just the basic principles of exercise training. And then try and help them to increase their physical activity. It doesn't matter what it is. Maybe it's dribbling a basketball. Maybe it is marching in place in a chair. It doesn't matter. Just get them moving at whatever level is reasonable for their level of fitness, as well as where they're at in treatment. I would love to go on and on and on for hours, which is what it would take for me to explain all the ins and outs of exercise progression for cancer patients. There's a lot of valuable free information on our website at thecancerspecialist.com. And if you're interested in learning more and specializing in working with cancer patients, we have our cancer exercise specialist and breast cancer recovery BOSU specialist advanced qualifications that are available, and a new course coming out in the next couple weeks, Pound Palms for Recovery. So check out our website. If you want to speak to me personally, you can call me at 503-502-6776. Have an awesome day and a great rest of your week.